start off tonight, we're very honored to have a live update from the chairman of the House Education and Labor Committee, our very good friend and long-serving congressman from the 3rd District, Chairman Bobby Scott. Congressman, welcome. I hope that you've been safe in Washington and give us an update.
Well, I'm safe in Newport News. The background is just background, so we're hard at work. I saw a tweet the other day that said that this is the first time in history that you can help save humanity by sitting on the couch, watching TV and surfing the internet. Please, God, don't mess this up. So I've been helping to save humanity, but I've been on a lot of phone calls, working with my colleagues, trying to address a lot of different issues involving in the pandemic. I serve as chair, as you indicated, as chair of the Education and Labor Committee, and a lot of the response to the coronavirus is within the jurisdiction of Ed and Labor. And what's not directly in is a shared jurisdiction like healthcare. We have employer-based healthcare policies, and half the people that have healthcare in the United States get it through their employer. So half of the healthcare debate is within the community. Things that affect workers, a lot of it is ways and means, if it involves direct money, but a lot of things like worker safety, things like that are within our committee. We passed several bills to address the pandemic. We've been focused on my committee on education, paychecks, and health. On education, we provided first for school lunches. One of the things you notice when you start closing schools, that if the children aren't in school, they're not getting school meals. A lot of students, most of their nutrition during the day comes from the school meals. And so we provided waivers and additional funding to make sure that those meals continued. This was not an administrative nightmare for schools. Instead of providing the meals at school, providing them somehow with at home, because that's exactly what they do during the summer. And so, basically whatever you did last summer, do that, and to make sure that the children get fed. We also passed on one of the bills, about 30
Yes, Senator. Yes,
funding for education. But say again?
Yeah, you're coming through.
Okay. We passed about $31 billion for education, about half K through 12, half higher education. K through 12, there are very little strings on it because we know that these school boards are really stressed trying to provide education. We gave flexibility. Some schools need to sanitize the schools. They need to provide technology so that they can do distance learning. We're really blessed in this area because we have WHRO providing course content. A lot of areas don't have that benefit, but teaching students who aren't there is a challenge. Some of the localities are providing laptops for the students that don't have them, whatever it takes to help them through that basis. For higher education, we insisted that half the money be used on the students. They've been pretty much in a lurch. They're in the middle of the semester, where they're going to go, how they're going to get there. If students are as broke as I was when I was in college, if they close the campus and you have to go home, how are you going to get home? Well, a lot of the money went for airline tickets and bus tickets, so kids could go home so that they'd have somewhere to stay. A significant amount of money, $1 billion, was spent for minority serving institutions. Hispanic serving institutions certainly qualified to make sure that the additional stress that those colleges have could be addressed. In terms of money, to the extent that we could provide cash to individuals, we eliminate a lot of problems. When people start losing their jobs, they can't pay rent, they can't buy food, they can't pay their bills, but if you can continue their paychecks, a lot of those problems evaporate. The first thing we did was a rebate, $1,200 per adult, $500 per dependent child under 500, under 17. In addition to that, unemployment compensation for those that lose their jobs. In Virginia, the unemployment compensation tops off at about $300 and some a week. We provided an additional, over and above whatever the state pays in unemployment compensation, an additional flat $600 a week. That would replace the income for the median worker and alleviate a lot of problems, and also put a little more money into the economy. That is, we have a consumer-based, as the Chamber of Commerce knows, we have a consumer-based economy, and to the extent that consumers have some money, the economy that's on the way to a recession can have some support.
Congressman, I can appreciate that drastic times calls for drastic measures. I would say that some of our members pointed out that the generous unemployment benefits come close to about 50 grand a year. In my business, half the people make that, half the ones don't. What we did is we took some of the paycheck protection money, roughly 25%, and rebated it to the loyal folks who didn't grab the unemployment checks. I hope as we move forward, folks will be willing to come back to $35,000 and $40,000 a year jobs after being on that unemployment.
Well, one of the things we need to do is increase the minimum wage. A lot of people are paid the minimum wage, which is way under the poverty level. People who work full time should not be in poverty, but that's a debate for another day. But the workers have that money and are able to spend it. We provided paid sick leave and paid leave under certain circumstances. I'm not sure very many people are taking advantage of that. But we had investments in childcare because the children were out of school. A lot of children were taken. A lot of younger children were taken out of daycare because the older kids were there, and a lot of people were out of work, and so they didn't need childcare. A lot of the childcare facilities were closing up. We wanted to make sure they were open for the essential workers that really needed childcare facilities, and we put a little money there and into Head Start. In healthcare, we provided money for testing and vaccines. We don't have nearly enough tests, and the vaccines aren't there yet, but when they are, that should be without copay or deductibles on behalf of the individuals. Going forward in healthcare, one of the things we're looking at is the covering the costs of COVID-19 related healthcare costs. This thing hits randomly. If you, a lot of people will not get infected. A lot of people that get infected will not have any meaningful symptoms. Some will have light symptoms, and some will be in the hospital in intensive care running up bills of tens of thousands of dollars. Even if you've got nice insurance, with a few copays and deductibles, you're going to have problems. And so we need funding for people to have those bills paid. We tried to get, but we were unsuccessful in opening up the marketplace, the Obamacare marketplace, so people who decided not to get insurance could get in and get insurance. That didn't happen, but if we do that, we'd have to reimburse the insurance companies, because the first people to jump in will be those most at risk of getting sick, and that is a insurance pool that is not the same insurance pool they thought they were insuring when they set the rates.
The governor is in a tough spot, walking a fine line, as all governors are. Congressman, how do you think Governor Northam is doing walking this tightrope?
Well, one of the things we don't have a lot of is a good, consistent direction from the federal level. We haven't had any sense of urgency on testing from the very beginning. We've had comments that the tests are great. Anybody who wants a test can get a test. That has been the message all the way through. That has never been the actual case. We aren't testing anywhere close to the number of people we need to test, not even the order of magnitude. If we're going to go back, if we're going to open up the economy, one of the first things you have to do is test. and what they call contact trace. When you find somebody that is positive, you need to go and find the people they had contact with so that you can contain the virus. If you wait until you notice people have gotten sick, it is way too late, because this is an unusual disease. You've got about a 14-day, 5 to 14-day incubation period where you are not symptomatic, and you're spreading it all over the place. And those people are spreading it all over the place. By the time you notice that there's some people with symptoms, it is spread almost out of control. We need massive testing and repetitive testing to make sure that we are keeping track of who has the disease. You want to track their contacts. You want to make sure the people who have tested positive quarantine themselves. You don't need to quarantine everybody like we're doing now. You just need to quarantine those people that have tested positive. But if you don't know, you just have to quarantine everybody. I think the governor was when he decided to close the schools and do other things, that was the right thing to do. Let me make a couple other points of things coming up. One is COBRA benefits. As you know, when people lose their jobs, they lose their health care, but they can keep their health care. All they've got to do is make the COBRA payments. But if you got a family policy, that could be $1,000 a month. You just lost your job. You don't have $1,000 a month. And so you want to make sure that you can make those payments, and those ought to be subsidized, because if you don't subsidize those payments, that's a change in circumstance would entitle you to go into the marketplace. And so we're going to subsidize, without a job, we're going to subsidize in the marketplace what the insurance, or they're going to go on Medicaid. And so we're paying one way or the other. The only problem is that when you get new insurance, you might have to restart your deductible. You got to get a new set of providers. 3 months later, when you get called back, you got to tell those providers bye-bye. You got to start your deductible all over again. It's just a mess. It's much better if people can just keep their insurance. During the 08-09 recession, we did that with a 2/3 subsidy, and most people couldn't even afford the 1/3. So we need to more heavily subsidize that, closer to 100%. And finally, let me just mention the workplace safety. OSHA has not, during this entire time, come up with any emergency temporary standards for safety that would enable them to come in and enforce new standards for safety. We've had outbreaks in meatpacking plants, prisons, grocery stores, nursing homes, mail deliveries. Each one probably needs OSHA needs to use its expertise to find out exactly what has to happen to protect workers. I checked into a hotel when we were in Washington voting the other day, and there was a plexiglass screen between me and the person checking me in. People checking me in were wearing masks. That little bit of protection would probably have, in my judgment, has a profound effect on protecting them from the virus. That couldn't have cost that much. Some grocery stores now are requiring customers coming in to wear masks. Some have a little plexiglass barrier between the cashier and the customers checking out. And these little things can't cost that much, but OSHA has to come in and establish enforceable guidelines, working with the Centers for Disease Control to make sure that our workers are protected. They haven't done it. They have issued in some areas with healthcare workers, and just in the last few days, meatpacking plants, they have issued unenforceable guidance. You can do this if you want. This is a nice thing to do, but not enforceable. And people are dying. And when, like I said, by the time you have discovered that people have symptoms in a meatpacking plant, everybody's got it. They're all up on top of each other. They're working close together. Nobody's wearing a mask. Then you find you got a problem, and then you test, and everybody's got the virus, and they've been going home infecting their families, everybody is infecting it, and the whole community has what they call community spread. Those are we need to OSHA to step up and have enforceable regulations. Some of them you can do without much expense. If people want to talk about a tax credit for improvements that you need to protect the workers. I mean, that's the kind of thing that within the order of magnitude that we're spending money, that wouldn't be a big deal. So we need to protect workers. We're not doing it, and that's one thing that we'll be working on in the next legislation.
Well,
Congressman, one of you touched briefly on it, but one of the most tragic things that's happened is that light being shined on the nursing homes and senior homes. And, you know, for example, in the Richmond area, the Canterbury, over 50 people have died from being in there. And I mean, just as a whole, there needs to be more cohesiveness, I think, between the feds and between the state, that what's happening in some of these nursing homes is just abominable. And there's nobody standing up for them. I would hope that out of this, that we'll be able to take a closer look, a harder look, and it's just unconscionable that in this country.
Let me tell you, Randy, the unconscionable part of it isn't the first nursing home or the second. They didn't do anything after the third, fourth, fifth, all over the country.
That's exactly right.
The first outbreak was and some of them aren't nursing home suggests medical
Washington
support.
State.
It's just a senior citizen assisted living. These are congregate, and you have people kind of wandering around, nurses providing services, going from one person to the next. If one person has it, everybody's going to have it. There are things that you can do that OSHA ought to be in there requiring, like during a pandemic, maybe everybody ought to be wearing a mask. Maybe everybody ought to be washing. You ought to have little sanitizer things in outside each room. So when you go in, you kind of wash your hands before you go in. I mean, they're little things, and these things don't cost a whole lot. But what have they done? What has OSHA done? Nothing.
Thank goodness our small businesses have been resilient and nimble and are implementing some of these plans on their own.
You're right. You're absolutely right. The businesses have done it on. Those meatpacking plants closed themselves down because they knew it was unsafe. Where was OSHA? OSHA should have been there. OSHA should have shut them down. They didn't, but they recognize on, and you can't wait for a meatpacking plant to decide, well, this is unsafe, we have to close ourselves down. OSHA should have been in there, protecting the workers. And they weren't. And you're right. The shipyards have been implementing. And the Newport News, I know they've rearranged the shifts so that there are fewer people in the main shift, more people at night, so people can kind of spread out a little bit. They have people wearing masks. They've got social distancing to the extent that they can in a shipyard. They've done a lot of little things. Where is OSHA? OSHA isn't anywhere. They ought to be in there helping this, and each shipyard has to kind of home bake their own formula. OSHA ought to be in there with expertise, telling them what they need to do to protect the workers, and nowhere to be found. And that is an absolute outrage that each business has to kind of figure it out on their own to figure out what to do to protect the workers. That's why OSHA is there.
And then, Congressman, one last topic, if you will, one issue that you and I have agreed on for the last 25 years as criminal justice reform, and I'm pleased to say that you finally reached some significant bipartisan success. Are there some more steps you think you'll be able to take, or have we gone about as far as we can for the time being?
Well, we called it a first step for a reason. It was a first step. It did a little bit. It didn't do all that it could have done, One of the major things you can do on the federal level is abolish mandatory minimums. And anything short of that is not being serious. Mandatory minimums will at some point require a judge to impose a sentence that violates common sense. If a sentence makes sense, you don't need a mandatory minimum. The judge can impose that sentence. If it doesn't make sense at all, the mandatory minimum requires the judge to impose it. And so you get some girlfriends, and this is not an unusual situation, girlfriends serving decades because the boyfriend was selling drugs. The boyfriend turned the girlfriend in, so he got a reduction in time. The judge, you are sentenced based on the quantity of the drugs, and of the whole conspiracy, not what you had to do with. And so when the young lady who didn't know anybody in the conspiracy, she might have taken a message, she may have driven the guy to a drug deal. Okay, she's a co-conspirator, she's in. And so she pleads guilty, mercy of the court. When a judge looks up at the chart and says, let's see, a ton of crack, you get 25 years. I mean, that's more than murderers, rapists, and kidnappers get. That doesn't make any sense.
No,
But that's because of mandatory minimums, that's what you get.
we had judges appointed by my old boss, Ronald Reagan, walk off the bench whether to impose some of those sentences. So I applaud the work you've done.
It's bipartisan.
For some pardons from the president before the day is over.
It's bipartisan, and I think the real breakthrough came in Texas when the Texas legislature was told that they needed to appropriate $2 billion in prison construction to keep up with the growing prison population. And somebody said, well, that doesn't make good sense. Let's see if we can spend about 10% of that, 200 million statewide, in intelligent investments in criminal justice to reduce crime and save money. Let's see what that would do. Well, they tried it, and they looked up, and they reduced crime so much that they not only didn't have to build any new prisons, they were able to close some of the prisons they had. Now, that creates an interesting coalition. All the liberals like the more humane criminal justice system. A lot of conservatives like the fact that you just saved $2 billion. You know how much tax cutting you can do with $2 billion? Well, that puts a lot of people on the same side of the ledger. And so after that, you had a coalition of people. And the only people that really haven't joined that coalition are politicians, because politicians have found that there is no political downside to being ignorant on criminal justice. You can be about as ignorant as you want to be, and there's no political downside. The ones that get hit for being soft on crime are those that try to be intelligent and do the right thing and make investments that reduce crime and save money. Those are the ones that get in trouble. Voting for mandatory minimums, voting for longer sentences, voting for foolishness, voting for slogans and sound bites never gets you in trouble. There's an old adage that no good politician ever votes against a crime bill named after somebody. I mean, you have some heinous crime, you come up with a bill with a draconian penalty to it, and everybody gets roped into it, and all of a sudden people are serving decades for similar cases, but not nearly as serious. I mean, that's how you get 3 strikes and you're out. One guy stole a pizza, and all of a sudden he's serving 25 years. And that's what you get. So if you can work on the politicians, there's a lot of progress that can be made in criminal justice.
Agreed, Congressman. The law of unintended consequences.
Yeah.
Thank you for your time. I look forward to seeing you again once the quarantine is over, Congressman.
Look forward to it.
Congress, always a pleasure. It's good to see you again.
Good seeing you, Congressman.
All right, y'all take it easy.
All right.
You too.